I'm Jessica Brooks and I work for the Murrumbidgee Patient Flow and Transport Unit as the nurse manager. As part of my nurse manager role, I coordinate patient flow in the district for the 32 hospitals, and I also run the critical care advisory service when I'm on shift. So we access the patient's notes through eMR for every single patient that comes through us. So if we do a transfer from Wagga to Griffith or from Tumut to Wagga, I'll access eMR and read the patient's notes while I'm having a chat to the nurse about the appropriateness of the transfer and how fast we need to do it. Because the notes are live, we're able to access them as the nurses are writing them. Instead of having to be waiting for phone calls to find out how the patient's going for updates, we can access the observations online to see if they're current, to read new doctor's notes, read new nurses' notes. It's made things a lot faster. So having accurate documentation is super important in patient flow and critical care. We need accurate documentation to provide the correct care, move the patient to the correct facility or hospital, and to have the right treatment. So when a nursing staff or doctor calls in, I always clarify the right number for the patient when I'm accessing it. Usually double check their name and their date of birth and ask if the documentation that they've given that I'm reading out loud is the one they've written for that particular patient. So if the wrong information is put into a document on eMR, we can give the incorrect treatment to a patient. We can move the wrong patient to the wrong facility, might delay transfers in treatment and compromise patient care. I think it's really important for the students to focus on correct documentation. As a practicing clinician, it's vital in the health field, and technology is only going to keep advancing, so I think if they focus on learning to understand the systems correctly and enter data, they'll be great.